Now, today, schools in several cities in Maharashtra have reopened as daily COVID cases are declining there. This time around, based on the advice of the state COVID task force, the closure of schools was limited around 3 weeks post the Christmas vacation to avoid the tremendous learning gap that students are facing, as well as physical schools were closed all through 2020 since the pandemic began and almost entire 2021. So it'll be interesting to see, the COVID graph in Maharashtra as schools have reopened. But to talk more about the impact COVID has had on children and what we're seeing in this particular third wave, we're joined by Dr Naveen Thacker, Executive Director, International Paediatric Association. Thank you so much, sir, for joining us this morning. And I think this is a question a lot of parents have. There's been so much anxiety around children over the last 2 years with the pandemic. And what are we seeing in this third wave? What have we observed? Are infections increasing among children?
Yes, infection is increasing, but still we see that these are mostly mild or asymptomatic cases. So if we see the zero prevalence report of previous wave, particularly second wave, Delta wave, where zero prevalence revealed that children were infected before that time also. But still, what we yesterday I also had a lot of interaction. Still, there are. It's not that children are getting a serious disease or say hospitalization. Definitely there will be, because the Omicron is so transmissible and number will increase so much. So there will be some increase in some absolute number, but still the children mostly have the mild or asymptomatic disease.
All right, sir. So another, question parents have, and now, like we saw in Maharashtra, schools have reopened. So what precautions should parents take to protect their children?
So that's a very good question. And throughout this pandemic, we have been arguing that schools should be last to close and first to open. So that's a very welcome step. And I congratulate Maharashtra Task Force for this good decision. And we also, we should never link vaccination of children with reopening of the school. We have to understand that there are many other ways where we can decrease or prevent the infection, which includes mask above 5 years of age, good ventilation in a school, which is most important, and they have to do reorganize like that. Social distancing, and keep watch on say if the children are having symptoms, to isolate them, and also immunizing the say eligible population and also the teachers. That's very important to reopen the school, and I'm very happy that Maharashtra is going that way. And it is very because there are a lot of other damage. We know that Omicron is also mild, but still we continue to punish the children, and the indirect effects of pandemic on children are tremendous. We always say that children are hidden victims, and the biggest impact of pandemic is on the children, not on the adults, even if we calculate in any way. And there are a lot of data to support that. And unfortunately, school closure in India was longest.
Right,
so
it was the longest, in fact, 2020 and then 2021 also. Mostly schools were closed, and it's had a terrible impact on children, which will also still learn in years to come. But sir, you said, talked about Omicron being mild, and we've also been told that usually children are more resilient, they bounce back faster. The worry is, of course, that if they're carriers and they come back to their families and spread the disease there. But do we know more about how the variant behaves in children?
So that's a very good question, and what we have seen from original Wuhan virus to Delta, and now Omicron is still, we have to see the data, but from Wuhan to Alpha and Delta, what we have seen that children have mild disease. Second thing is the transmission potential of children is always low. It is always more likely from the adult to adult transmission rather than child to adult transmission. And also they transmit it for the lesser time. And but what we have seen that viral load increase from the say Wuhan to Alpha and Alpha to Delta, and maybe more. It may increase even in the say Omicron. And gradually, we cannot say that children don't transmit the disease, but still, when it is so prevalent, so much community transmission is going on. So we cannot just isolate one. When you are open, you have rest or everything other thing is open, and we just close the school. So singling out pointing out to the children that they transmit, that's not correct. And definitely with variant, this is changing to certain extent, but still children transmit, but to lower extent and for shorter period of time. And there is always more possibility of adults giving infection to the children. And with the vaccination status going up, this is slightly shifting towards down, but still it will always be there that children have less viral load than adults, whatever is the variant, and children transmit it for the lesser time.
All right, well, that's reassuring to know. And now with Maharashtra opening up schools, hopefully other states will follow, given, the local situation in those states. And yes, get those children back into classes. And, as you said, this has had a tremendous impact on children and learning across the country. Thank you so much, Dr. Thacker, for joining us on the program today. Well, let's now take a look at the situation in metros, and daily cases seem to have started crossing the third wave peaks. In Mumbai, at least, cases are down from the peak by 88%. 2,550 new cases were reported yesterday. That's 28% lower than the day before. If we talk about the capital, then 9,197 new COVID cases were reported in Delhi. The positivity rate is down to 13.32%. And however, if we talk about Karnataka, well, there the cases have crossed 50,000 in a day, and Bengaluru is reporting over half of these cases. The positivity rate is a huge 22.77%. Well, to talk more about the third wave, we're now joined by Dr. Dhiman Kahali, Director, BM Birla Heart Research Center, and Dr. Hrishikesh Pai, Senior Consultant, Lilavati Hospital, Mumbai. Thank you so much, doctors, for joining us. We were talking about, schools reopening in Maharashtra, which is a very welcome step. And there also seems to be a sense that perhaps now the trend is that at least in Delhi and Mumbai, that the cases may have crossed the peak. First to you, Dr. Hrishikesh Pai.
Yeah, I think, good morning, everybody. I think that I think we have crossed the peak, and there is a study that has come from Madras IIT which has shown the RR rate of 1.57. So I think in the next 2 weeks, India will peak as well. So I think it's a very good sign. We have, this particular strain of the virus is highly infective, but it doesn't have that much admission in the hospital. So, and there's not that much of morbidity. And probably the vaccination, most of the healthcare workers have taken the 2 doses, and the third dose is also going on. That may also increase the immunity to a certain extent. Also, the community immunity is where the vaccination program in Mumbai has been very, very well organized and very effective. And I think all that has, the task force has done a very great job in implementing the program very aggressively. And that has given us very good fruits now. We are seeing the fruits of what effort was taken in the last 1 year. The fruits are being manifested just now in the form of the falling rate of the disease.
Right. Dr. Dhiman Kahali, if we talk, about the metros again, after the festival season, we've seen this spike in most of the metros, and now it seems to be waning a bit. But the worry is that a lot of people, there was a lot of travel during the festival season, and the worry is that people will take the disease back to the, rural pockets, and it's going to spread rapidly over there as well.
Yeah, your data, what you have been showing since morning itself shows what you have been talking. That in Mumbai metro itself, city, 2,550 cases, and it is down by 28% in comparison to Saturday. But if you look at the Maharashtra situation, it is 40,850. So it's very high. In Karnataka, it is 50,200 cases. Also in Bengaluru, it is 26,800 or 300. So in metro, some of the metros, the numbers are coming down, like in Kolkata also, it has come down. In West Bengal, the total number is 7,000 today in last 24 hours. And I can give you some more information regarding some of the optimistic, predictions from none other than World Health Organization. what was telecast in, France 24 TV during midnight yesterday, that hopefully Europe will see the end of this pandemic after this Omicron wave. I don't know how far it is going to be true.
Yes, that was very interesting because the WHO in charge of Europe, he spoke about how this is so infectious that it's going to just spread rapidly. He said in the next couple of weeks or months, it's going to affect 80% of the population. And he says post that, because Omicron is so infectious, post that there will be this lull, and because of vaccines and because of infections, that it may not be able to spread any further, and we might see the end game, is what he called it, of the pandemic, isn't it, Dr. Kahali?
Yeah, absolutely. What you have been telling, they have mentioned categorically, WHO, that after this Omicron wave is over, it is plausible, that was the language given by them, that Europe may send end to the game, pandemic game. That we don't know what would happen to this part, that is the Asia, US, and also, Latin America, because what you see globally, yesterday in UK, the incidence of new cases in 24 hours was 75,000. And as we have been talking for the last 12 minutes, that the incidence of death was very low, even among the adult population in UK. Only 75 people died. In Russia, it was 53,000 patients who were affected during the last 24 hours. In UK or US also, the numbers are very high. So why this geographical differentiation that Europe will be over, but will not be over, that needs to be clarified by World Health Organization. And it's true that the numbers will go up a little because there have been so many melas, there has been so many traveling around, because people have become now restless. Yesterday in Brussels, in the capital of Belgium, there was a demonstration by 50,000 odd patients against the COVID cups, which is happening isolated way in India also.
That's right. In Europe especially, we've seen a lot of protests over, COVID protocols. Though I have to say in India, we haven't, seen the same level, which is very good, that everybody's just accepting of science and going for the vaccinations.